In a world driven by rapid technological advancements, we find ourselves in a unique position to question the role of technology in the realm of healthcare. Can tech truly replace your doctor? Let us delve into the profound possibilities and limitations of this intriguing question as we explore the future of medical consultations. Imagine a future where your smartphone or wearable device is not just a tool for communication or fitness tracking, but also your primary healthcare assistant. Across the globe, technology is unfolding new horizons in how we view and receive medical attention. It starts with apps that diligently monitor your vital signs, remind you to take your medications, and even analyze your symptoms. Artificial intelligence, or AI, has the potential to revolutionize diagnostics, providing quick and often accurate assessments based on vast data sets. Consider the power of telemedicine, which has already transformed the way we approach healthcare. Offering convenience and accessibility, it allows patients to consult with medical professionals from the comfort of their own homes. This technology has been a lifeline, particularly in remote areas where medical attention is sparse. However, while telemedicine offers many benefits, it also underscores a critical question. Can it entirely substitute for the traditional doctor's visit? AI's capabilities extend into more specialized fields, such as radiology and pathology. Machine learning algorithms can analyze medical images with remarkable precision, at times surpassing human capabilities in detecting anomalies. This innovation could theoretically reduce the workload of healthcare professionals, freeing them up to focus on more complex cases. However, it is essential to recognize that even the most advanced AI cannot replicate the nuanced judgment and empathy of a seasoned physician. Despite these technological leaps, the human element remains indispensable. A machine may provide data, but it is the doctor who interprets, contextualizes, and communicates this information to the patient. The emotional intelligence and compassion of a doctor are irreplaceable qualities in patient care. Imagine receiving a serious diagnosis. The empathy and assurance a doctor provides in such moments cannot be coded into an app. Moreover, there are ethical considerations to contemplate. Privacy concerns loom large in the digital age, and healthcare data is particularly sensitive. As we increasingly rely on technology for medical consultations, we must ensure robust safeguards to protect patient information. Additionally, technology is not universally accessible. Disparities in access could exacerbate existing inequalities in healthcare delivery. So, can tech replace your doctor? The answer lies in a balanced integration of technology and human expertise. Technology should serve as a powerful tool that complements, rather than replaces, the crucial role doctors play in our lives. We are heading towards a collaborative future where technology enhances the efficiency and reach of healthcare. Yet it is the partnership between tech and professionals that will provide the best outcomes for patients. In conclusion, while technology is set to enhance the landscape of medical consultations, it is unlikely to replace the indispensable role of doctors entirely. As we advance, let us embrace the benefits of technology, while also cherishing the irreplaceable human connection that defines the art of medicine.